Hey, I am super excited. This is, I guess, the first official episode of the Hormone Hub podcast. I promise you, I have a better microphone, so if the sound quality isn't amazing, one of my, output jacks, I'm not a tech person, this is something you'll quickly realize, is not working efficiently, so I have to get a little bit of an adapter situation to make sure everything can plug in so I can charge my computer, have my camera plugged in, all the tech things. But I wanted to kick off this episode with something that was near and dear to my heart, and that is heavy periods, heavy menstrual bleeding, spotting, when it's a concern, when you should be getting help, and how to know. Because this is something that I'm quite familiar with, and that is heavy periods. Growing up, I experienced all the things. When you're driving in the car, you have your tampon in, you have this gush or whatever the feeling is, and suddenly you're like, holy crap, thankfully I have that backup liner, that backup pad on. And so I am no stranger to this. I've had experiences where I've bled through things and I've been bleeding so much, I've wondered, is this normal? And it wasn't until I became a naturopathic doctor and actually got my own training that I understood this information. And to the point of this whole podcast, it's like I want women to understand their bodies more. And I think this topic is important because your experience is only yours. And so, for example, my perception of pain, if I'm someone who deals with chronic pain, I might have a higher tolerance than someone who maybe has never experienced a ton of pain and has a painful situation or an injury that they're, dealing with. And so I think it's really important to understand these pieces. Not to mention it's embarrassing, right? I speak to individuals all the time who have periods and they'll talk to me about XYZ symptom and they'll say, but that's normal, right? Because they have no idea. We only know our own experience. And so because we're the only ones experiencing our own period, it's just easy to think whatever you're dealing with is normal. So I'm here to talk to you about a specific post I found on Reddit that is talking about what is a period and when you should be concerned. And I figured I would kind of take that post and use it as a jumping off point to create this episode and give you some more information that you will find useful. Well, I hope you find useful to understand your period and bleeding that is a period and bleeding that isn't and all the things. So let's just jump right into it. So this post is called Bleeding is Not a Period. The post goes, I see a lot of posts on here where girls refer to their ongoing bleedings as if it's a period that's just going on for weeks. Hear from a lady that's on blood thinners and also had a period that lasted 4 weeks and got me into the ICU. If you bleed for more than 10 to 14 days, it's not a period. If you bleed through a Super Plus tampon every hour for days straight, it's most probably not a period, it's urgent bleeding. A bleeding, regular, healthy menses does not do that to you. If you experience a worrisome amount of blood, see a doctor. Don't martyr your way through it. You can literally die from a uterine or ovarian bleeding. It's not an overstatement. It's a freaking medical emergency. A worrisome amount of blood is a valid reason for calling in sick at work and going to an emergency appointment or emergency room or calling an ambulance if your country allows. If you get a few drops of a nosebleed, you'd think you're okay. If you're passing clots and it's going on for hours, you'd go to an emergency room, right? So that's the post that I read, and I thought, you know what? This is something that's really important because I feel like this is something, again, as individuals with periods, we just don't talk about. We assume that whatever we experience is normal, and it's hard to know when something is urgent and when it should be evaluated. So let's get into it. What is a real period? So menstruation is the shedding of the lining of the uterus. Your lining of the uterus is also called the endometrium. So this shedding of the lining is going to obviously be accompanied by bleeding. It occurs in monthly cycles throughout a woman's reproductive life except during pregnancy, starts at puberty, and stops at menopause. So menopause is defined as not having a period for 1 year. So if you haven't had a period for a full year, that is considered menopause. When your periods are changing and you're in that like phase before, that's considered perimenopause. So your menstrual cycle begins with the first day of bleeding, which is day 1. Now, in the fertility world and the hormone period problem world, we define day 1 as the first day of full flow. That's important to understand because you could have some spotting or some bleeding prior to that, and we may not technically consider that day 1. So keep that in mind, but I'm going to be talking about spotting a little bit more. Interestingly enough, your cycle can last 28 to 35 days. That is considered a normal length for a cycle. 10 to 15% of women actually have 28-day cycles, meaning most women have longer or shorter, but the average is about 28 to 35. Anything else, again, if you're like 22 days is far too short and 42 days is far too long. So like I said, the average is about 28 days. So what is the difference between a real and a fake period, and why should there be a difference? You'll notice myself and a lot of individuals who are in the holistic healthcare space or the alternative space, so functional medicine, naturopathic doctors, for example, will talk about a real and a fake period. I want to be very clear. When we're looking at a real and a fake period, it's important to understand what menstruation is. So like I just said, menstruation is the shedding of the lining of the uterus. When you are on birth control, you are still going to shed the lining of your uterus. But why do I say that it's not a real period versus when you shed the lining of your uterus not on birth control? So it's not really a true statement. I just want to be very clear. It's not actually true that you don't have a real period. But I like to differentiate between a synthetic hormone-controlled period and a natural endogenous hormone-controlled period. So why does this matter? If I'm looking at the root cause of your concerns, I need to know what happens independent of birth control. So if you see me and you were concerned about PMS, acne, spotting between periods, you're on birth control, if I just take you off of your birth control and these symptoms resolve, then they weren't actually problems that were going on. They weren't actually hormonal imbalances. They were side effects of your medication. And so this is why I differentiate between a real period and a withdrawal bleed. It's all the shedding of your uterus, but one is controlled by synthetic hormones and one is controlled by your endogenous hormones, the hormones that you make. And now understanding that, you can understand why it's important to see how your hormones work on their own. How does birth control impact your period? Like I just said, it causes a withdrawal bleed. So in most cases, depending on which hormones, depending on the dose of hormones, depending on what type of hormonal birth control you're using, typically the goal is to stop ovulation in most cases. And then sometimes, again, depending on the hormone concentration, the amount of hormones, it'll make the cervix and the uterus a less favorable place for implantation and fertilization. And so when we're taking hormonal birth control, we're taking the hormones and whatever dose they're at, they're going to keep us kind of more level. This is why birth control often helps with symptomatically with things like PMS. But what happens is when you stop those pills, so when you get into a sugar pill pack, you actually have what's called a withdrawal bleed. So you're going to, be on these hormones, stop taking them. The act of stopping those hormones is supposed to act as if your natural cycle was leading towards a period. And so to understand that, we have to understand our cycle. So when I'm talking about the menstrual cycle, I break it up into 3 pieces. The first piece of it is the follicular phase. Think of this as dominated by estrogen. We're building the lining, we're developing the follicles, and we're getting things ready to ovulate. Then we have the middle of the cycle. This is ovulation. This is like the star of the show. This is where your luteinizing hormone comes up to a peak, estrogen comes up, and this allows for a dominant follicle or that egg that's ready to go, ready to be fertilized, to be released. Once that is released, we have what's called a corpus luteum. That corpus luteum is going to make progesterone in the second half of the cycle, that progest hormone. At the end of your cycle, when there's no fertilization, there's no pregnancy, the hormones drop, and that drop causes a bleed and the shedding of the lining that we've now made and maintained. And so now we have a period and it starts all over. And so when you're on birth control, that actually mimics that place, right? Typically when you're on those sugar pills, you're mimicking that withdrawal and you're getting a bleed. Now, oftentimes I will get asked, well, is it a problem if you're skipping your birth control pill? Or you're not skipping it, rather, continuing it to skip your period is what I mean. And the answer is no. And the reason why is because the level of hormones that you're being given synthetically is actually typically not enough to build up your lining to the point where it becomes harmful. The harmful or the risk of not having a period naturally is that you risk something called endometrial hyperplasia, or like cancer in the uterus, because your lining is not shedding and it's just building and building and building. So with birth control, with hormonal birth control, it is not the same mechanism of action, so it doesn't come with the same amount of risks. So let's just talk about times where you can bleed with birth control. Now, sometimes it could be an adjustment period. So you're taking birth control, your body's getting used to the hormones. Maybe the dose isn't right for you. Maybe you need a different dose. Typically, the rule of thumb is that we give the lowest effective dose as it pertains to birth control. And so with that in mind, your doctor will typically start you on the lowest dose and then go from there. So it is possible that your dose just isn't high enough and you need a different dose to have the same effect on your period. But you can have spotting at the beginning while your body kind of works its way out. Typically, we see spotting the majority of the time when I see patients who are spotting and they continue to spot, it's usually with an IUD rather than a pill. The pills seem to be a little bit more tolerated in the patients that I see, at least. But you can actually have excess bleeding with the copper IUD. Now, not many sources really know why exactly this happens, but the idea is that it might be due to vascular changes which regulate blood flow to the uterus, and these blood flow changes have been found to be greater in those who are using the copper IUD versus those with normal menstrual bleeding. Again, more research is needed there, but anyone who starts the copper IUD has actually been shown to have heavier periods. I have that experience myself. As I was put on the copper IUD, I wanted a non-hormonal form of birth control that I could just kind of, set it and forget it. And I noticed much heavier menstrual bleeding. And that was something that I was well informed with. It was a risk I was willing to take because I wanted a non-hormonal birth control that I felt confident in while I was learning a lot more about fertility awareness. And so that's what I had chosen to do, but I actually got it removed after 2 years because I just couldn't handle how heavy my periods were, especially coming from a place where I already had heavy periods. And so this was just kind of worsening everything that I was going through. The other thing to understand and note is that research has shown that upon starting the copper IUD, 6 in 10 people reported increased cramping and 7 in 10 reported increased bleeding during the first 3 months of use. These symptoms have been shown to decrease over time in most people. Again, I experienced it personally, and 2 years being on it didn't change anything for me, so that's why I ended up getting removed. For people who do experience increased menstrual bleeding, there is an increased risk of developing anemia due to excessive blood loss. Among copper IUD users with increased irregular bleeding, there may be an increase in prevalence of bacterial vaginosis, but again, more research is needed. So, how long should your period be and how heavy? So, let's get into numbers. Sometimes patients will tell me, oh, my period is so heavy and it's so long, but really they end up only bleeding for 2 or 3 days. And so, yes, it is heavy in that 2 or 3 days, but their overall blood loss isn't a ton. And so let's just talk about what it means to have a heavy period. Blood loss can be up to 75 mils in an average cycle. So your whole period from start to finish should be about 75 mils or less. Anything more than 80 mils is considered a heavy period. And now you're like, wait, how do I know how much blood I'm losing in a period? Now, to put it into perspective, a fully saturated light tampon can hold about 3 mils of fluid. A fully saturated super tampon can hold up to about 12. So, and then if we look at pads, a daytime pad can hold around 5 mils of fluid, and a fully soaked overnight pad can hold 10 to 15 mils. So this information can just be found on Google. What I would recommend you do is when your period starts, decide what you use. Again, the Diva cup is nice, or whatever other cup you use, because it actually has the markers so you can see how many mils you're losing. I wanted to look, because this is something I didn't do before I started recording, the menstrual disc milliliters, because it would be interesting to see how many milliliters does a menstrual disc hold. According to the Lancet, a menstrual cup or disc can hold 10 to 38 mils, or 2 teaspoons to 2 tablespoons. That's a wide range. So let me just look at the one I just purchased. So I just got the Pixie cup, which is a menstrual disc, mils. And let's just see how much okay. The Pixie cup is available. I'm going to have to look, because I actually, 35 mils. Let me just see. Okay. Pixie disc. I should have looked at this before, but I didn't even think about it. So all of this stuff is available. Reusable disc holds 35 mils of fluid, or equivalent to 3 super tampons. So this is an important thing to know when you are trying to see how much blood you're losing, because it can seem like a lot, especially if you're using something like the Diva cup where you're actually seeing the blood. It can be pretty scary. You take it out and you're thinking, holy smokes. So getting an idea, even if you go through a period and you write down every time you take out a tampon, use a pad that's completely full, take out your cup, and see how much blood you're actually losing. Because if you are losing more than 80 mils, this is considered a heavy period and should have investigations. So that's the first thing to understand. And the other thing is, how long should your period last? Now, the average period is anywhere from 2 to 7 days. So I often have patients say, well, I only bleed for 4 days. Is that normal? Is that too short? Does that mean my lining isn't very thick? And in my experience working in the fertility world, I haven't seen a correlation of having, let's say if you have a light period, that means you don't have a thick enough lining. And if you don't know what I'm talking about here, this pertains to fertility. You have to have the thickness of your endometrium has to be enough for implantation to be successful. And so I personally haven't seen that correlation with necessarily having a light period and having problems with a lining. Usually that is a thing that is looked at and measured in patients when they go for their ultrasounds and things like that. So I wouldn't say that if you have a light period that means anything until we can correlate that with additional findings, because that could just be your, again, coming back to like what your norm is and really understanding that. So 2 to 7 days. Bleeding for 8 or more days is considered long. And again, even if you're bleeding 4 days, if you're losing over 80 mils of blood, then that is important that you have that fully investigated. So that's why there's 2 markers, right? You could have a really, really light period and bleed for 7 days, and you actually it's just 7 days, you don't lose that much blood, it's kind of annoying, but it's not overall a huge deal. But if you're bleeding for, let's say, 9 days and it's super heavy, that is a big problem. So let's talk about what causes heavy bleeding, when you should worry, is your period a medical emergency, is spotting a concern, and then we'll talk about some brief overview of testing so we can really understand what the next steps are and how to make sure that this is fully evaluated and looked at. So what causes heavy bleeding? There can be a number of reasons. One of those can be fibroids, endometriosis, endometrial carcinoma, which is going to be a greater risk, estrogen dominance, and progesterone deficiency. So let's talk about some of these pieces. Fibroids are typically a benign growth, so not cancerous the majority of the time in the uterus, and they're going to be found in different locations. So we could do a whole episode talking about fibroids, so I'm not going to go into the details here, but part of the symptom profile of having fibroids, depending on A, their location, B, their size and severity, and if there's more than one, that may impact your bleeding. So you might find that you're spotting between cycles, or you have a heavy period, or you have really painful periods. That can be a sign of fibroids. The other thing is, when we're looking at fibroids, it's important to understand that other symptoms can happen that can point us in the direction of a fibroid diagnosis. So what am I talking about here? I'm talking about maybe painful bowel movements, painful urination. Depending on where the fibroid is and how big it is, it can give you urinary or digestive symptoms, things like bloating, things like constipation. And then we have to rule out endometriosis. So endometriosis is when tissue in the uterus grows outside of that area. And so what happens is this is an estrogen-driven condition. And I look at endometriosis as a pain syndrome. It's going to cause typically heavy periods, typically painful periods, can cause painful bowel movements, painful urination, depending on its severity, depending on the location of this tissue. And so this can be a reason why you have heavy periods and something that warrants investigation, because the implications of endometriosis can include things like fertility issues. Endometrial carcinoma is what we worry about when you don't have a period, because like I said before, if we look at how we break down the cycle, we break it down into 3 pieces. We break it down into estrogen at the beginning, ovulation in the middle, progesterone at the end, that progest hormone, creating that environment for hopefully implantation. And so when we have this unopposed estrogen at the beginning of your cycle, it's going to theoretically build and build and build that lining, and you can have breakthrough bleeding, and this is what we see when we have estrogen dominance, progesterone deficiencies. But what can also happen is that lining can build and build and build, and it can increase the risk of carcinoma or cancers forming. And this can cause bleeding as well. Now, let's talk about estrogen dominance and progesterone deficiency, because this is more of a nuanced type of term. The reason why I say this is because it's not typically, like, I've never seen estrogen dominance as a diagnosis in a medical journal, but it is what I see a lot as a naturopathic doctor, because hormonal imbalances without frank disease cause the majority of things that I see in clinical practice, things like fibrocystic breasts and PMS and acne and painful and heavy periods and spotting between periods, and all of those things are related to estrogen dominance. And so what is it? Estrogen dominance is basically when estrogen is high relative to progesterone, and I say that because it can happen in a number of ways, in a number of scenarios. And what happens is, number one, it can be that you just make a lot of estrogen. And so when you're making a lot of estrogen, regardless of where progesterone is, if progesterone's normal and estrogen's high, you're going to be in an estrogen dominant situation. If you don't have progesterone, this typically happens when you are not ovulating. Then you are going to not ovulate, not make that corpus luteum, as a result, not make progesterone, and then you're going to be low in progesterone. So even if your estrogen in that scenario is normal, then you are going to have a estrogen dominant situation. So to be clear, estrogen dominance can be a progesterone deficiency, but it can also be excess estrogen. And we see this in a lot of estrogen-driven conditions as well. We see progesterone deficiencies. In addition to that, a lot of the chemicals that we're exposed to, endocrine-disrupting chemicals, things in our environment, things like parabens, things like phthalates, these actually act as exogenous estrogens, and so they can worsen the picture. They can worsen this estrogen-dominant picture because they come in, they act as an xenoestrogen, they act like an estrogen, but they're not, and they're stronger, and they're more harmful, and they're going to act on those more harmful pathways of estrogen function. And so that can equal an estrogen dominant picture. And a lot of individuals will ask me, why is everybody estrogen dominant and not progesterone dominant? And it's because more likely than not, any sort of health impacts, any sort of stress, any sort of environmental situation, digestive issue is going to make you not ovulate. And when you don't ovulate, you don't make progesterone. And when you don't make progesterone, you're automatically in a relative estrogen excess, a relative estrogen dominance. The other piece of that, when we look at estrogen dominance, and again, we could talk a whole episode about estrogen dominance, but we're talking about bleeding right now. And so, like I said, it's that unopposed estrogen that can cause breakthrough bleeding or spotting or heavy periods, because the estrogen was never opposed with any progesterone while it was growing. And so it's important to look at that in your symptom profile as well. The other piece is your digestion. So we have an enzyme called beta-glucuronidase, and beta-glucuronidase helps to recycle your estrogen. And so it looks at everything you're ready to get rid of, and it says, okay, well, this seems helpful, and it decides to use your estrogen again. And so what happens here is when our beta-glucuronidase is too high, we're going to recycle more estrogen than we actually need to. When our beta-glucuronidase is low, we're going to recycle less. We need a balance. And so oftentimes when I'm doing digestive testing with my patients, this is what I'm coming across. I'm coming across individuals with high beta-glucuronidase, and I'm saying, oh, we need to lower that for your estrogen dominant type symptoms to be resolved. So when should you worry, and is your period a medical emergency? So here's some red flags to look out for and the reasons why your bleeding would be a medical emergency. Bleeding postmenopausal is a red flag and something that should be looked at, especially if you haven't had a PAP, because we have to understand where blood can come from. Blood can come from the uterus, the cervix, the vagina, right? And so it's important to understand where that's coming from. If you have bleeding and you are postmenopausal, you need to be evaluated. Postpartum hemorrhaging. If you just had a baby and you are bleeding and the bleeding gets worse, it is really important that you talk to your doctor, because postpartum hemorrhaging can be a significant issue. Bleeding that is excessive during what you would deem as your normal period, like I've already said, more than 80 mils means a heavy period. Get investigations from your doctor to find the root cause. Bleeding that lasts longer than it should. So if you are constantly bleeding, even if you are just spotting, but you're just constantly bleeding, this warrants investigation. The other thing to ask yourself is, are your iron levels impacted, right? The big thing is when we lose blood is that our iron, we're going to become iron deficient. And I think because a lot of individuals, especially women, are iron deficient, I think we just brush it off as like, yeah, I'm iron deficient. It's not a big deal. But we don't realize that iron deficiency is correlated, it is a direct cause for heart palpitations, anxiety, trouble sleeping, lightheadedness, weakness, fatigue. Like there are so many things. Even when we look at things like weight loss, iron plays a role. Thyroid function, iron plays a role. I think we underestimate the things that play a big role, the things that most people tend to be deficient in, things like vitamin D and iron. We really underestimate how important these things are. Things like magnesium. These play a role in so many of our systems that we really need to make sure we're staying on top of our nutrients. And so if your iron levels are significantly affected, this can have really a lot of implications for your overall health. Again, how much blood are you losing, right? Do you have an infection? So what is that bleeding paired with? Do you have bleeding with a fever and abdominal pain? Is there a weird discharge or smell? That's something that you need to have evaluated. The other thing is if you may have just been pregnant or may have had a miscarriage, understanding whether or not it's retained products of conception, that can lead to infection. That is really important. And finally, if you could be pregnant, an ectopic pregnancy is something we need to rule out. So this is where you have a pregnancy somewhere other than the uterus. You might have abdominal pain, you might have shoulder pain, you might have a fever, depending on what that looks like. So it's important to know when your period is a medical emergency. And I think a lot of women, similar to what the poster said, a lot of women act like a martyr and tough it out, and you only know what you know and you only know your experience. And so if your mom had painful, heavy periods, now you're like, wow, I guess I just can't handle the pain, or I guess I just can't handle the bleeding, or I guess just having a period sucks. This is important that we understand why. Let's talk about if constant spotting is a concern, and we'll talk about what spotting is versus a period, etc. So a menstrual bleed, like I said, is the shedding of the endometrium at the end of the menstrual cycle, or I guess the beginning. Spotting is bleeding that doesn't require a tampon or a cup or a pad. And so spotting versus non-menstrual bleeding is kind of hard to differentiate, really because non-menstrual bleeding doesn't seem to be associated with your period. But you can be spotting leading up to your period, and you could say, well, is this non-menstrual bleeding? Is this spotting up to my, or is this my period? And really, like I said, if we go back to it, I define it as first day of full flow. So if you are a person who gets a light period, then when you start to lightly bleed, that is your day one, right? If you're a person who gets a heavy flow and you have a couple days of brown spotting, I would call that spotting. And then your day one is the first day of full flow for you. So spotting can come, like I said, bleeding can come from your uterus, your cervix, or your vagina, whereas a period is coming from your uterus. It is your endometrium. This is how we can differentiate. So why would we spot? I already mentioned hormonal contraceptives. Like I said, this is a common side effect specifically of like the IUD. So if you notice that you continue spotting with something like this, you may want to try another brand or a different method of contraception. Post-intercourse bleeding. Sexual intercourse can cause trauma to delicate tissues, so it's important to talk to your doctor if this is happening regularly. If it happens once, probably a one-off, but if you also haven't had a PAP in a while, you're starting to spot after sex, it's really important that you get that fully evaluated so we can see what the root cause of that is and we can rule out anything that may be harmful. Postmenopausal bleeding. So like I said before, bleeding after you are in menopause, meaning bleeding after your periods are done for 1 year, is a red flag and something to get investigated. So any bleeding after you are in menopause needs to be evaluated as soon as possible, especially if you haven't had a PAP in a while. In perimenopause, this is where your periods and your hormones are going to be fluctuating. So you could go 3 months without a period, then you get a period, then you go 2 months without a period, and then you get a period. And so this can be really back and forth. And if you ever are concerned, the best option is to speak to your doctor. Cervical cancer is obviously one of the scarier causes. Again, some signs of that: bleeding after sex consistently, postmenopausal bleeding, unusual discharge. Get that all checked out. But this is why having regular screening tests is really important. Pregnancy or implantation bleeding does not happen to everyone, but weeks 5 to 8 typically are going to be when you spot, if you spot. And the research suggests that there's no risk of an increased miscarriage when you are spotting early pregnancy or you have implantation bleeding. But again, any bleeding in pregnancy, I always say speak to your healthcare provider because you want to make sure that everything is good in your case. And again, I come back to you only know what you know. So if you're looking on the internet and you're saying, well, I'm spotting, I think this is fine, but it might be heavier than the person on the internet is talking about, right? So it's important to always get assessed. And when in doubt, ask your healthcare provider. That is exactly what they are there for. Again, fibroids, which I already spoke about, can cause spotting. Cervical polyps are growths on the cervix. This is something that we look at through different imaging and something that we can attribute to spotting or bleeding between periods. So that's important to get evaluated as well. Ovulation spotting is an interesting one because research doesn't really have a definitive answer for this one. This can be due to a rapid surge in estrogen following a plunge in estrogen. So again, can be due to the changing hormones. Research actually showed that there were higher levels of estrogen, luteal progesterone, and luteinizing hormone around ovulation in regularly menstruating women who experienced mid-cycle ovulation spotting. So basically, this one study concluded that anyone who spotted at ovulation actually had higher hormone levels overall. I mean, they had a higher luteal progesterone, which we want high progesterone in the luteal phase. We want high luteinizing hormone, which helps us ovulate. And so depending on when those hormones are going up, this could be a good sign. A 2012 study linked mid-cycle bleeding to ovulation, noting that women with mid-cycle bleeding were not anovulatory. So meaning basically they use this mid-cycle bleeding to say this means that you ovulated. And so they were saying in these individuals, it meant that it's not that they are having anovulatory cycles. In fact, it can be a good thing and showing that they ovulated. But we have to be careful. Again, when are you ovulating? Is it only when you're about to ovulate and you're around like the time or you've just had intercourse and you're bleeding after, but it just so happens to be, at the time of ovulation? We need to look at that. So again, nothing is in isolation. We need to look at the whole clinical picture, the whole symptom profile. And low progesterone can cause spotting. Specifically spotting before your period. So if you're the type of person that has like brown spotting or even bright red spotting leading up to your period, it could be that you ovulate, but your progesterone doesn't get very high. And as it's coming down, it comes down a lot quicker than it should. So that can be something that we can test and manage. And the last thing is thyroid concerns. If you have a thyroid issue, This can cause spotting, heavy periods, late periods, and can be an independent predictor for fertility issues. And so getting your thyroid checked is really important. All in all, understanding when your period is actually a period, how to track it, how to know if it is a medical emergency, how to track the amount of flow, track the days. I recommend downloading a tracker. And if you're looking into getting testing, you want to make sure that you are going at the right time of the month. So for progesterone, that's day 21 or 7 days after ovulation. Estrogen, I'm typically either getting it done with progesterone or around day 3 of your menstrual cycle. If you're getting a thyroid evaluation, you want to make sure you get all of the thyroid evaluations, a full thyroid panel, so you can really see what you're working with. And until next time, guys, this has been the Hormone Hub podcast, and I'm Dr. Laura Pipher. Goodbye.